You know, Russ, when patients come to see us, their concerns are often focused on their teeth. But in many cases, the real issue isn't the teeth themselves, but the foundation they're built upon, the jaws.
That's an excellent point, Brandon. Sometimes, to achieve a truly healthy, functional, and stable bite, we have to look beyond just moving teeth with orthodontics and address the underlying position of the jawbones. This is where the powerful collaboration between an orthodontist and an oral surgeon comes into play.
It is, and it's a specialty area that can produce some of the most dramatic and positive changes for our patients.
That's what we want to talk about today. Welcome everyone to Oral Surgery Insights. I'm Dr. Russ Lieblick, and I'm here with Dr. Brandon Rehrer. Today we're going to be exploring the world of corrective jaw surgery, also known as orthognathic surgery, and how it's used to correct skeletal irregularities of the face and jaw.
Our goal is to demystify this transformative procedure. We want to explain what it is, who can benefit from it, and what the carefully planned journey from consultation to final result looks like for a patient.
So, let's start with a clear definition. In simple terms, orthognathic surgery is a procedure or set of procedures designed to surgically reposition the upper jaw, the lower jaw, or both to create a better bite and improve facial harmony.
The key reason for this surgery is a skeletal discrepancy. This means the upper and lower jaws have not grown in proportion to each other or to the rest of the face. When this happens, no amount of orthodontic treatment, like braces or aligners, can fully correct the bite. Because the problem isn't the alignment of the teeth on the bone, it's the alignment of the bones themselves.
We see this manifest in several common ways. A patient might have a significant underbite, where the lower jaw has outgrown the upper jaw, causing the lower teeth to sit in front of the upper teeth.
Or the opposite, a severe overbite or overjet, where the lower jaw is underdeveloped relative to the upper jaw. Another common issue is an open bite, where the front teeth don't touch at all when the back teeth are together, making it impossible to bite into things like a sandwich. Asymmetry, where the jaw is shifted to one side, is also a common reason for this type of surgery.
These skeletal issues create a host of challenges for patients that go far beyond just aesthetics. There are significant functional problems.
Absolutely. Difficulty chewing is a primary concern. An improper bite can make it very hard to incise and grind food effectively, which can lead to digestive issues and dietary limitations.
Patients often come to us after years of just making do, avoiding certain foods or only being able to chew on one side. They also might experience speech impediments, like a lisp, because their teeth and tongue can't find the right position to form certain sounds clearly.
Chronic jaw pain, or TMJ disorders, are also frequently associated with these skeletal discrepancies. When the bite is not aligned, the jaw joints and chewing muscles are under constant strain, which can lead to pain, headaches, and muscle fatigue. In some cases, a recessed lower jaw can even contribute to obstructive sleep apnea by narrowing the airway.
And while the functional improvements are the primary goal, the aesthetic impact is undeniably significant. When we restore balance and harmony to the jaws, it naturally creates a more balanced and pleasing facial appearance. For many patients, especially younger ones, this can have a profound and positive impact on their self-confidence. The amazing part is that it's dramatic and immediate.
It is absolutely critical for listeners to understand that orthognathic surgery is not a standalone procedure. It is a process that is almost always performed in a close, carefully planned partnership with an orthodontist.
This collaboration is essential for success. The journey for the patient is typically divided into three main phases. The first is pre-surgical orthodontics.
During this phase, which can last anywhere from 12 to 36 months, the orthodontist uses braces or other appliances to straighten and align the teeth within each individual jaw. The goal here is to get the teeth in the ideal position on their bony foundation, even if it temporarily makes the bite look or feel worse.
That's a key point that we always prepare patients for. The pre-surgical orthodontics are designed to uncamouflage the skeletal problem, setting the stage for the surgical correction. It's a necessary step.
The second phase is the surgery itself. Once the teeth are in the correct position within each arch, the oral surgeon then surgically repositions the jaws into their correct relationship with each other and the rest of the face.
The final phase is post-surgical orthodontics. After a period of healing, the patient returns to their orthodontist for a few more months of treatment. The orthodontist will then do the final detailing of the bite, settling the teeth into their perfect final position now that the jaws are aligned. It's a beautifully orchestrated multi-stage process.
The planning process for this surgery has been completely revolutionized by digital technology. It's incredibly precise. We start by taking a 3D CBCT scan of the patient's facial skeleton and digital scans or models of their teeth.
We then merge this information in specialized software to create a highly accurate three-dimensional virtual model of the patient's head. On the computer, we can then perform a virtual surgery.
We can make the planned surgical cuts on the digital model, move the jaw segments in all 3 dimensions with sub-millimeter accuracy, and evaluate the effect on the bite and the facial profile in real time. We can run multiple simulations to determine the absolute optimal final position.
This virtual planning is incredibly powerful, not just for us as surgeons, but for the patient as well. We can sit down with them and show them a very accurate simulation of their predicted outcome. They can see how their bite will be corrected and how their facial profile is expected to change. This is a huge part of helping them feel confident and informed in their decision to proceed.
And to translate that precise digital plan to the operating room, we often use 3D printed surgical splints or guides. These custom templates fit onto the teeth during surgery and allow us to position the jaws in the exact location that we determined was ideal during our virtual planning, ensuring the real-world outcome matches the digital plan.
The surgery itself is, of course, a significant event, and we ensure the patient is completely comfortable. It is always performed under general anesthesia in a hospital or accredited surgical center setting.
A common concern for patients is scarring. It's important for them to know that the vast majority of the surgical cuts, or osteotomies, are made entirely from inside the mouth. This means there are typically no visible scars on the face.
During the procedure, the jaw or jaws are carefully repositioned according to our pre-surgical plan.
And they are then stabilized in their new position using small, strong, medical-grade titanium plates and screws. These act as internal fixation, holding the bones securely while they heal.
This modern technique of rigid internal fixation has been a game changer for patient comfort. The days of having the jaws wired shut for 6 to 8 weeks are, for the most part, a thing of the past. While some temporary elastics or guiding bands are often used, patients can typically begin to move their jaw and return to a soft diet much sooner than they could years ago.
The recovery from jaw surgery is a process that requires patience. An initial hospital stay of a day or 2 is common. Swelling and bruising are expected and are a normal part of the healing process, typically peaking in the first few days and then gradually subsiding over several weeks.
We manage the patient's post-operative comfort very carefully with appropriate pain medication. A modified diet, starting with liquids and gradually progressing to soft, non-chew foods, is necessary for about 6 weeks to allow the bones to heal without being subjected to heavy chewing forces.
Following their hospital stay, we see patients for regular follow-up appointments in our office. We monitor their healing, check their bite, and guide them through their recovery process. The return to normal function is gradual, but the final outcome is well worth the journey.
It really is a journey. There's the physical healing, but also the emotional process of adapting to a new bite and seeing the gradual emergence of their new facial profile as the swelling resolves. We are there to support them through every step of that adaptation.
So, to bring it all together, corrective jaw surgery is a powerful, predictable, and truly transformative procedure for individuals with significant skeletal jaw and bite discrepancies that cannot be corrected by orthodontics alone.
It is a collaborative journey, a true partnership between the patient, their dedicated orthodontist, and the oral and maxillofacial surgeon. Each member of that team plays a crucial role in the final success.
Through meticulous digital planning and precise surgical techniques, we can achieve profound and lasting improvements in a patient's function, their overall health, and their confidence.
It is one of the most rewarding areas of our specialty, as it so clearly demonstrates our ability to positively impact a person's entire quality of life. We hope this discussion has helped to demystify this incredible procedure. Thank you everyone for joining us on Oral Surgery Insights.
We appreciate you spending your time with us, and we trust this conversation has been both informative and reassuring.
Thanks for listening.